Postpartum Support International, or PSI, is a nonprofit that was founded in 1987 by Jane Hodgman in Santa Barbara, California. The purpose of PSI is to increase awareness among public and professional communities about the emotional changes that women experience during pregnancy and postpartum. PSI is headquartered in Portland, Oregon, and has members all over the world, including volunteer coordinators in every part of the United States and in more than 36 other countries. The vision of PSI Georgia is that every woman and family throughout the state will have access to information, social support, and informed professional care to deal with mental health issues related to childbearing. It is our mission to promote awareness, education, prevention, and treatment of perinatal mental health issues affecting mothers, their families, and their support systems in all areas of Georgia. The PSI Georgia chapter is made up of a dedicated group of individuals with various backgrounds and expertise committed to furthering the mission of PSI within Georgia and improving the state affairs of our local communities. We aim to train medical and healthcare providers across Georgia to better screen, serve, and support the emotional needs of moms. We educate moms and their families about what perinatal mood and anxiety disorders are, and we refer moms to knowledgeable and trained professionals across Georgia. Third, we advocate for improved healthcare for all moms across the state of Georgia. PSI and PSI Georgia have various innovative programs to support moms during the perinatal period. The PSI Helpline is a toll-free telephone number anyone can call to get basic information, support, and resources from one of our volunteer coordinators in both the Spanish and English languages. The online provider directory is an expansive list of providers and support groups put together to help moms and families quickly and easily identify trained perinatal mental health providers in their local communities. There are a number of provider trainings that we offer in various formats, including a free perinatal mental health one-on-one presentation delivered at providers' offices to educate them on the best practices for screening and referring patients for perinatal mental health challenges. Climb Out of Darkness is the largest international event raising funds and awareness for the mental health needs of families. During this event, we gather as a community with fellow survivors, supporters, and providers to climb out of the darkness of the stigma and shame of perinatal mood and anxiety disorders. Our expansive advocacy work in collaboration with a number of partners across the state has led to a proclaimed Maternal Mental Health Day in Georgia with support from our state representatives, as well as securing more than $1 million in funds to support a maternal mental health telepsychiatry line. We also offer online support groups for moms led by maternal mental health trained therapists, as well as peer-led support groups.
Did you know that Georgia has the second worst maternal mortality rate in the United States? About 1 in 3 pregnancy-related deaths occur 1 week to 1 year after delivery. And so we know this postpartum period is such a vulnerable time for moms. But it's not just vulnerable for them in their physical health, it's vulnerable for them in their emotions and their mental health as well, which is why maternal mental health is just as important as mom's physical health. And so why do we even need new mom peer support? Well, about 1 in 5 women experience perinatal mood and anxiety disorders, such as depression, anxiety, bipolar disorder, and obsessive compulsive disorders. And so while these disorders are very treatable, there are many communities and areas of Georgia that do not have enough trained providers who understand how to identify and treat mood and anxiety disorders.
Georgia is ranked 50th in the U.S., having the highest maternal mortality rate of all states, and maternal mental health is one of the primary drivers of maternal deaths within our state. Our mothers are dying because they cannot get adequate support and services for maternal mental health.
And even though Georgia has the worst maternal mortality rate in the country, the funding for innovative technology-based maternal health programs is facing severe budget cuts.
PSI Georgia has partnered with Healthy Mothers, Healthy Babies Coalition of Georgia, one of the leading maternal infant health organizations in Georgia, to address this maternal mental health issue. Our organizations are working together with the Georgia Department of Public Health to launch the state's first ever maternal mental health program.
One of our signature programs is a peer support group model to train local women to serve as peer support group facilitators and create an online network for women throughout our state. Unfortunately, due to the financial crisis in Georgia, those funds are likely to be cut as soon as July 1.
Our solution is to put into place a sustainable, low-cost, flexible ways to support women with PMADs. We know that peer support specialists can be very effective in providing social support that women with PMADs need. We also know from running our pilot online support groups that women find the support groups are well sought after and an accessible way to get the help that they need.
If this model can work for us, it will be easy to adapt to other resource-poor settings in the U.S. and throughout the globe.